Hello students, in the class of Human Histology video series, myself Dr. Akshay Dubey, Professor in the Department of Anatomy, Himalayan Institute of Medical Sciences, Swami Rama Himalayan University, Dehradun, Uttarakhand. In this continuous series, now I am going to present you another interesting video on the genitourinary histology basics. Today in this histology slides video, I will discuss about the kidney histology and the histology of ovary, and then I will give you the ideation how these things are present here. My idea of view is not to just make you mug up all these things, but just to make you more aware with the concept of the histology, how the tissues look like into the various divisions, various H&E staining, and if you know this idea of how the tissue is look like, then you can unfold the deeper aspect of that organ histology as well as the related histology. So in this series, I have chosen first one in the genitourinary system, that is the kidney. Kidney, a very famous organ. Kidney is used for transplant and other function. Kidney is now in more hot topic in medical sciences. And so understanding the kidney is also very, very interesting because so many diseases are related with the kidney histology. Let's see deep into this. I hope that the medical students who are understanding this histology must have an idea of glomerulus, Bowman's capsule, and the proximal convoluted tubule, distal convoluted tubule, collecting ducts. All these terminology must be acquainted with you. So let's go into the histology of this. In this very histology, thanks to the diffuse atlas of histology, I have taken this slide from that atlas. This is the most beautifully depicted glomerular structure into the kidney. Can you see this? There is a layer, squamous cell layer, there's a parietal layer, the visceral layer is also here, and then inside it is the histology of vessels. Now you see that it is the complex organ has various components like squamous epithelium, like blood vessel, and if you combine them, that makes a histology of the complex organ. So first, going to this video, please also refer our earlier videos of the simple histology so that you can get you have an idea of the simple histology and then combine them to make it more understandable here. So here we see the various blood vessels are present histology. Old student must be knowing how a blood vessel looks like in the under microscope. This is the parietal layer, and in a parietal layer we have seen the squamous epithelium. Then we see this type of various rounded section. Do you remember our first class? Remember that video where I have given with the example of a tube. If you take a tube section at the various places, how does it look like? So in this video, that knowledge must be implemented here. Here we see the lumen is there inside this and it is a diameter wise there. But here we see a bigger lumen is present with a bigger diameter is present. Well, there is another one here where lumen is bigger and the cells are little bit lighter. So we can clearly see this is a one layer of the tubes. There is another area of the tube and there is a third tubule here. It is a longitudinal structure with various cuboidal shaped cells are present into its wall. What does it mean? That means we have the three areas of the tubes, and these areas are actually repetition of an overly coiled tube, and in the section we see this one. These tubes may be related with this nephron or maybe of the another nephron which is situated either it's deeper to that or superficial to that. There is a pattern if you take various sections at various levels and sagittal, coronal in another way or transverse section, then only you can make the complete 3D picture of how other neurons are structured, but that's of a research area. But I am telling you this one so that you can understand how that knowledge of planes in the histology could be implemented here, and without that you cannot understand this complex structure. Just coming to the basic of the three basic tubes here. This tube here, we see the lumen is short, right? Lumen is short and overall diameter is short as well. And in the lumen we see various villi-like structures are, microvilli-like structures are present here into the lumen. That means the cells in the wall containing some microvilli or villi-like structure which are covering up or the filling the lumen here. And here we do not see it. The lumen size is bigger, so the whole of the tube size is there, and there is no such microvilli or villi-like structure which are present over here, and the lumen is almost clear. In the kidney histology, if you already know this, then you can know that this one is proximal convoluted tubule, and this bigger lumen and the lighter staining is distal convoluted tubule. Now refer to your books again. Think about that what is the function of proximal convoluted tubule and what are the function of distal convoluted tubule, and if you correlate with this function about these microvilli structures, then you can clearly interpret why these structures are present here, right? Then we see another arterioles is present over here. Okay, there is another veins and other structures are present. How I identify this is the artery or this is the artery and this is the vein? Do you remember the lecture of the veins? Go through that and see the vessel structures. Yes, it is the thick wall that is the artery, and it is the thin wall, this is the vein is present over. Since this is the microstructure level, so we do not call it artery or vein, we started calling arteriole at this level and venules at this level. Now here we see this the bigger channel. It is the section of the vertical section of a tube, and this one is named as collecting duct. So this is the collecting duct. If you remember the anatomy of the nephron, the collecting duct is the air where all the filtered structure ultimately drains into. So this is the structure of collecting duct. In between here, what it could be filled? Any guess? Yes, you are right. It is filled up of connective tissue. So connective tissue, here we see in earlier lectures I have told you that connective tissue is a binding or the filling material. These both things you can see here, it is binding all this tubal structure together, also filling it that all the structures together. That's how the beautiful function of the connective tissues you can visualize over here. Okay. So this resolution is a high resolution and more than 40x you can see that. If you go under the 10x, you see a squeezed form on this of this structure. Maybe a little bit difficult to understand, but yes, you can understand that there is a various sort of the duct sections are present inside. Okay. So that is about the kidney histology. Now coming to the ovary, I have chosen ovary here because histology of ovary is very, very interesting, and it is one of those slides which you once see in your life and then you can never forget it, that this is the slide of ovary. For undergrads level, ovary is a boon in examination. If the slides you get in the examination, you can clearly pass it the examination because it's not at all difficult, but understanding or go into the deeper of the ovary, here ovarian histology is a little bit challenging. Let's see outside. From the outside, here we have a cuboidal epithelium, and it is pseudo named as germinal epithelium, though it does not have anything to do with the germination. It is named as germinal epithelium. It is cuboidal in nature and it's a false name. Then inside we see various sort of follicles are present, or the ovas in the various stage of development: primordial follicle, primary follicle, secondary follicles, and the mature Graafian follicle. Here I have shown you in this picture, peripheral are the earlier structures of the developing phase, and here we see a one mature Graafian follicle. This is the oocyte or the real ova is present over there, and then all the structures around them are the supporting structure for them, which is a corpus oophrus. Then there is a blank space around this, big blank space is present here, and that is named as antrum or the area. Follicular epithelium, granulosa cells are present over there, and then this whole area is covered with a little bit thicker structure, that's theca externa, and then there is a theca interna structure. So this is the structure of a mature Graafian follicle. After some times you may see it, it may rupture. Remember, at one section in the ovary, you do not see all the developmental phases in it. Though to the students we teach them in a one slide, it's very rare. You may see them, you may not see them. It also depends on at what phase you have taken out that ovary and making these sections. then so that you can see many as irrelevant or a zigzag pattern of the ovaries. That means you see a couple of earlier ones and then you suddenly see you the mature ones, because the in between are lost somewhere either deeper or the superficial to the section you have taken into the ovary. So in the ovarian histology, it is always required to take continuous section at a gap and then make the slides and then understand them. Then only you can get all sort of cells with the presentation. That give you the complete idea of the ovarian histology. So this is the ovarian histology. Beside this, there is a testicular histology and epididymal histology as well as present on the male genital side. I have not covered this one in this small short video. Maybe next time in the future may come with those slides as well. So till then, thank you very much for the patience listening.